Okay, so let's take a look at another important topic of pediatrics, that is Wilson's disease or hepatolenticular degeneration. So the important point about this disease is that it is the most common cause of chronic liver disease in children, and it presents with chorea, in which the child presents with handwriting alteration. There will be kayser fleischer rings in the eye on slit lamp examination, and there will be hepatic problems in childhood like hepatitis, cirrhosis, and fulminant hepatic failure. So chorea, kayser fleischer rings, and hepatic problems in childhood, these are the important presenting complaints of Wilson's disease. As we know that it is due to excess of copper deposition in the body, especially in the liver and brain. So the examination will include a blood exam including the ABGs, LFTs, PT, creatinine and urea to assess liver function, peripheral blood count to show platelets which might be increased in these patients, sodium, potassium, bicarbonate, calcium, magnesium, ammonia to check for other causes of hepatic encephalopathy or electrolyte imbalance, and glucose should be checked too early in acute phase of hepatitis, because in hepatitis liver disease can also cause glucose derangement. So ABGs, LFTs, PT, peripheral blood count, sodium, potassium, bicarbonate, calcium, magnesium, ammonia, electrolyte levels, and glucose. Then we should also do toxicology screen of blood and urine to look for other causes of hepatic failure like paracetamol toxicity, etc. And viral markers should also be assessed, and these include hepatitis B surface antigen, IgM antibody against hepatitis C, and IgM antibodies against hepatitis A, and anti-HEV antibodies, and anti-HCV antibodies, and antibodies against or antigens for cytomegalovirus, herpes simplex virus, and Epstein-Barr virus. So because as I told you that Wilson disease patients present with acute hepatic failure or liver cirrhosis, so we need to rule out all the other causes of hepatic failure or hepatic disease, so as we are sure that the patient is suffering from Wilson's disease. So copper studies will also need to be done, and these will include serum caeruloplasmin level, which will be reduced, and this is the best initial test, and serum copper will be increased, and the confirmatory test is the urinary copper excretion, which will be increased in these patients, and also the slit lamp examination, which will show kayser fleischer rings, which I already told you. So serum ceruloplasmin level decreased, serum copper increased, and urinary copper excretion increased. So these are the important copper studies. In addition to that, we should also be testing for autoantibody level like ANA, ASMA, LKM, and SLA, and ultrasound of liver and Doppler of hepatic veins will be done to check for hepatic function and hepatic status. So how will you treat a case of Wilson's disease? Let's take a look at that. So there will be two important treatment modalities. Number one will be the nutritional management, and second one will be the medical management. Nutritional management will include avoiding high copper content diet, for example avoiding liver intake, chocolates, nuts, and dry fruits, and also avoiding copper or brass utensils in kitchen for cooking, because these can also deposit certain element of copper in the diet. So avoid high copper diet like liver, chocolates, nuts, dry fruits, and avoid copper or brass utensils in kitchen. And the medical therapy will include lifelong treatment with chelating agent, and the chelating agent for copper is D-penicillamine with vitamin B6 and trientine. So these two are the chelating agent, D-penicillamine and vitamin B6 and trientine. And in addition to that, we can also give the child zinc acetate, and liver transplant in case of cirrhosis can be considered. And you should also screen the siblings, because it is a genetic disease, it has a hereditary potential, so the siblings also have a chance of having this disease. So the siblings of the parents and the screening of the parents and siblings should also be done. So these were some of the important points. Let's revise them once again. So Wilson disease presents with chorea, kayser fleischer rings, and hepatic problems. Important examinations include blood exam, toxicology screen, viral markers, copper studies, autoantibodies, and ultrasound of liver and Doppler of hepatic veins. But the most important of these examinations are the copper studies, which are specific for Wilson's disease. Okay. And the treatment options will be copper free diet and medical treatment with chelating agent, along with liver transplant in case of cirrhosis. So these were some of the important points regarding Wilson's disease, and I hope it was helpful for you guys. Thank you so much for watching.